Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.
Welcome to From Hair to There, a podcast about alopecia, where we bridge the gap between patients, healthcare professionals, and you, our listeners. We bring you diverse alopecia areata stories from around the world, highlighting the challenges and successes of living with alopecia areata and reminding you that you are never alone in this journey. Hair loss isn't just physical, it's emotional, mental, and even spiritual, and we're here to discuss it all. I'm Adam Kegley, Manager of Global Partnerships at Global Healthy Living Foundation, and your co-host for this episode. Today, I'm excited to introduce my fellow co-host, Supriya Surrender. She is someone who doesn't just speak about alopecia areata, she lives it and is a fierce patient advocate.
Thank you, Adam. It's been quite the journey for me as an alopecia areata patient advocate, and I'm here to share it all. I believe that every alopecia areata patient has a unique story, and by sharing ours, we can inspire, motivate, and uplift each other. Whether you're an alopecia areata patient, a caregiver, a medical professional, or someone just wanting to learn, this podcast is for you.
So tune in and let's embark on this journey from hair to there. We are kicking off this inaugural season of From Hair to There with 3 episodes highlighting experiences in Canada. Supriya, would you like to introduce our guests?
Of course, we have 2 wonderful guests with us today, Dr. Cathryn Sibbald, dermatologist in Toronto, Ontario, Canada, and Anthony Gilding, alopecia areata patient advocate in Toronto, Ontario, Canada. Why don't we start with each of you telling us briefly why you're looking forward to being with us on today's episode. Let's start with you, Dr. Sibbald.
Thank you so much, Supriya, and thank you for inviting me to this podcast today. So as you mentioned, my name is Dr. Sibbald. I'm a dermatologist practicing in Toronto. I graduated about 5 years ago from the dermatology program here. And then I did a 1-year pediatric dermatology fellowship in Philadelphia with a hair guru there, Leslie Costello-Socio, who does a lot of work in alopecia areata. So right now, I see about 80% pediatric patients and 20% adults. And I do have a monthly alopecia areata clinic at SickKids, the hospital where I work mostly. This has become an area that I'm very interested in, and I'm very excited about some of the upcoming advances in treatments and investigations that have been going on in this field.
Thank you so much. And now you, Anthony.
Yeah, so hi everyone, I'm Anthony, as you said. I'm very excited to be here because, as you mentioned, sharing stories can really inspire people and it shows people that they're not alone. And this is something that I wish I would have had when I was first diagnosed. So I'm looking forward to sharing my story and hopefully inspiring others.
Thank you so much, Anthony. And I think to kick us off with our first round of questions, I think I'd pass it over to you, Dr. Sibbald. And the first burning question I think we all have is, can you explain to us what alopecia areata is and how it's diagnosed?
For sure. And I'm glad that you started off with that because I think there can be confusion still with classification of alopecia areata. So alopecia, as we all know, is just hair loss, but alopecia areata specifically refers to a condition in which your immune system is attacking the hair follicle and leading to hair loss. And it can present either patchy or full hair loss. And we actually subtype alopecia areata. So you may have heard of terms such as alopecia totalis or alopecia universalis. It is all under the umbrella of alopecia areata, but totalis is when it affects the entire head and face, and then universalis is when it also affects body hair. How we diagnose it is also something that's very important to go over because this is really a clinical diagnosis, meaning that there is no test that you can do that sort of bings and says, yes, you have alopecia areata. We take the history of how it started, what other things were going on at the same time, family history of similar conditions, and we put that together with what we see on our clinical exam, so what a patient is demonstrating, and together that makes the diagnosis. And in that process, in our minds, we are sort of excluding some other potential mimickers of alopecia areata.
Thanks so much for that, Dr. Sibbald.
I think it's so important to have that clarification. I know a lot of times people will come to me on Instagram and message me and say, I don't understand why this is happening. All my blood work is normal. And it's unfortunately not as simple as a blood work panel. So thank you so much for adding that clarification. Anthony, did your diagnosis follow a similar path to what Dr. Sibbald described? I ask because I know for some patients, it's not always quite as linear, and sometimes it can be more of a squiggly line per se before one ultimately gets their diagnosis. So would you mind sharing a little bit about your journey to getting an official alopecia areata diagnosis?
Sure. So when I was about 7 years old, we noticed a couple of small bald spots on the side of my head. So this was back in 2006. And we went to my family physician and he said, this is alopecia areata. He gave me a corticosteroid cream, used it, the hair grew back, and I had hair for 7 years. And then when I was 14, it came back. And at that time, because it had been so long and I was so young when I first had it, I actually didn't know what it was. I forgot that I had alopecia when I was 7. So we went to my family physician again, and they said, yeah, this is alopecia areata. They gave me the corticosteroid cream again, and this time it wasn't working. The hair wasn't coming back. And so they made the decision to refer me to dermatology, which took a few months to be seen. And when I was seen, they confirmed that it was alopecia areata. So it was a little bit squiggly, I guess, just waiting to get that confirmation because my family physician was pretty confident that that's what it was, but they acknowledged that they're not the specialists, so they don't want to give a definitive answer. But once I saw dermatology, then I did get that confirmed diagnosis.
Thank you for sharing that. And looking back on your diagnosis journey, is there anything you wish you would have been told when you received your diagnosis, either from a dermatologic perspective or even mental health or wellness perspective?
Absolutely. So, yes to both. I wish that I would have been told about the unpredictability of alopecia areata because I was kind of under the impression that the hair loss that I had at the time was the only hair loss that I was going to have, and that hair would grow back with some sort of treatment. Myself and my family, we actually weren't aware that it could get worse. So when it did get worse for me, it was very traumatizing because I wasn't expecting it. And from a mental health perspective, I wish that I would have been given the resources like mental health support earlier because I think it hit me really, really hard when the hair loss became more extensive. I actually kind of went into reclusion and didn't go to school, didn't go anywhere for almost 2 years. And as you can imagine, that took very intensive mental health care to kind of get me out of that. And so I wish that I had been given access to those resources earlier so that I could have taken a bit of a more proactive approach with the hope of maybe not struggling as much as I did.
Thank you so much for sharing that. We always say the most predictable thing about alopecia areata is that it's so unpredictable. And, it really takes us on a whirlwind of a journey.
Totally agree, Supriya. And thanks so much for that, Anthony. I think you bring up something a lot of patients feel are missing, and that's resources and trusted sources of information. And that's really the beauty of something like this podcast and patient organizations like ours, and also like the Canadian Alopecia Areata Foundation that offers resources from everything from support groups, educational materials, and lots more to really help Canadians with alopecia live their best lives. And further what we just discussed, I think we wanted to talk a little bit more about treatment availability for patients. And I know it varies widely based on where patients may live, and that's certainly no different in Canada. Dr. Sibbald, I wanted to ask you where Canada is at with approvals for treatments, especially new treatment options, what might be on the horizon.
Yeah, so thank you for that question. And I think it's a very exciting time in terms of new treatments that are rolling out into the market. Most people will be aware of baricitinib, which is a Janus kinase inhibitor, which is basically a pill that you take on a daily basis to target the inflammation that's destroying the hair follicle. So that is a medication that has currently been approved in the United States for patients who are 18 years and up. And we expect that to come to Canada. I can't give you an exact timeline, but hopefully in the next year or so. Another treatment, actually, that's been studied and shown efficacy in 12 years and up is another Janus kinase inhibitor called ritlecitinib, and that as well is likely going to come to Canada in the next couple months. So very exciting.
Very exciting indeed. And actually, I'd just add that since this recording, ritlecitinib has been approved by Health Canada for the population you mentioned, Dr. Sibbald. It's certainly a new horizon in terms of opportunities for patients. Back to you, Anthony.
So, Dr. Sibbald, we know that you're quite involved in clinical studies here in Canada right now. And I was just wondering if you can share a bit about what you're doing and what your hope is for the outcomes.
For sure. These are studies that are quite dear to my heart. So there's one that's a little bit more sciencey that I'm doing right now, and one that's more focused on mental health. So the first one would be a biomarker study. And so what we're doing is we're testing the blood of people who have alopecia areata, and we're separating those people out into whether they have eczema or not. And then we're comparing them to people who have neither condition. So no inflammatory condition and no hair loss, no eczema. And we're seeing if there are any markers in the blood that could, number one, tell us like what's different about people with hair loss to help us inform treatment. And then could we use those, if there's things that are higher in the blood to monitor treatment response or side effects or target those things that are up in the blood, which we assume are contributing to the condition. So that's one study. It's actually done, and we're just working through the analysis right now. The other study is even more close to my heart in terms of something that I feel passionate about. And I think we've already mentioned it, but it's that mental health piece that is so prevalent in patients with hair loss. And so what we're doing is looking at a variety of different things that can happen to people who have hair loss. One of them is bullying. So we're doing bullying surveys of our patients. We're looking at insomnia, so problems falling asleep. And we're also looking at anxiety. And Anthony actually helped me a lot with a study that we did across Canada that was given to people who have alopecia and really showed that many people struggle with anxiety, even more so than depression, although both are prevalent. And so one part of this study that I'm doing is getting those questionnaires and finding out how common it is. But another part is actually trying out a little bit of a mindfulness app that you do every day that takes less than 5 minutes to see if targeting anxiety will help both the alopecia itself and the anxiety that's associated with it. So I think those would be my two big projects, and both exciting for me.
Incredibly exciting. Thank you so much for sharing that, Dr. Sibbald. I think that brings some hope in lots of different aspects, actually, for patients, I'd imagine.
For sure. And on a related note, maybe I'll ask Anthony a question, because I know that you're studying for your master's right now, and you hope to become a dermatologist, as well as you're very active in alopecia-related research with myself and others. So what has this experience been like for you, especially given that you experienced the condition that you're interested in studying?
Yeah, it's really interesting because when I was 14 years old and diagnosed again, I never would have imagined that one day I would be researching the same condition that I, at the time, felt like I was falling victim to. And so I really feel like I've taken my power back, and I'm using this experience to make lives better for everyone else. And I've always wanted to be a physician, but I didn't quite know what area I wanted to go into. And then having alopecia showed me the need for dedicated dermatologists to focus on this area. And as far as the research goes, it's been incredibly exciting. And, I have to just take a moment and really thank you, Dr. Sibbald, for getting me involved and giving me the opportunity to conduct alopecia areata research firsthand. And because of that experience, I'm now doing so much more. So thank you for that.
It's so interesting, Anthony, what you said. On another note, Supriya and I have talked to several different patients now, and what you'd said really struck a chord with me, and it made me think of the next question that I had for Dr. Sibbald, actually, which is about the differences between male and female patients. And I was wondering if you actually noticed specific differences in terms of how they might approach their condition or management of it.
It's a very interesting question. And I think my answer maybe 5 or 10 years ago would have been quite different. different. I think there are still many cultures that clearly differentiate males from females, but I think we're lucky in Canada that there's much more of a melding pot of female and male roles, and also many patients who are identifying as opposite genders these days. One of the things that I definitely need to consider with my clinical cap on is pregnancy potential. And so that will affect safety of medications when I'm talking to patients. I think more so than, the availability of wigs being different for males versus females and, maybe beard loss being something that males are more concerned about would be the eyebrow loss, because over and over again, and this is obviously both males and females, it's the loss of eyebrows that sort of help to define the face that I feel has quite a big impact on people. That being said, I also, on that note, have learned that everyone is different. You can't assume that someone doesn't like their eyebrows or likes their eyebrows or, how they feel. So I think actually the most important thing is asking the person who's in front of you, the patient who's suffering from hair loss, how it's affecting them, what matters to them. If they have hair growth, does it matter more for eyelashes? Does it matter more for scalp? And having that dialogue between the two of us.
Thank you so much. I remember for me, I lost my eyebrows at age 33, and I think that was so much harder than losing the hair on my head. I had no idea how much my eyebrows that I had had for almost 3 decades or a little over defined my face until they were gone. So I completely relate to that sentiment. Anthony, to build on what Dr. Sibbald mentioned, I'm curious to hear your perspective as a male living with alopecia areata. I think in Canada and the US, and honestly globally, there's this misconception that alopecia is quote unquote easier for males because society tends to consider a man losing their hair more acceptable than a woman losing their hair. Personally, I think that's a really unfair assumption because it invalidates how jarring and emotional alopecia areata can be for men too. So with that, could you tell us a little bit more about your experience as a male living with alopecia areata and how you've coped with losing a piece of your physical identity?
Yeah, I think that you've hit the nail right on the head. I think that society kind of normalizes any extent of baldness for men. And so when a man loses his hair, it's not looked at as a big deal. And so for me, everybody around me was kind of saying, oh, lots of men are bald. You shouldn't worry about it. You're fine. And some people were saying it to try and comfort me, but I would actually argue that it was doing the opposite. Because as you said, it really was invalidating my feelings and it was making me feel like I was overreacting almost. But in reality, I really, really struggled. And as Dr. Sibbald mentioned, for me especially, losing my eyebrows was the most difficult part. And I would always say to people, okay, yes, there are lots of men who are bald, but how many men do you see with no eyebrows? And so often when I said that, then they wouldn't have anything else to say. And yeah, I think for me, how I coped was it was really having the support of my family and my friends, and especially my dermatologist at the time. She was incredibly helpful. And mental health care, especially, was kind of what I needed to get me out of that reclusion that I mentioned earlier. And so my advice to anybody who, especially men with alopecia areata, is to seek that mental health care early. There's a lot of stigma associated with getting mental health care, but it really does help and there's nothing wrong with getting it.
I love that. Thank you for sharing that. I think that's so important. The one thing I always say is that even though it's hair, so many people minimize it and try to make it feel like your emotions involved with it aren't important because outsiders looking in just consider it a physical aspect of you. But us that have gone through this journey really understand the emotional aspect. And anybody that's struggling, just know that your emotions are valid. Anything that you're feeling is important, and you really deserve to be able to prioritize taking care of that aspect of yourself.
I couldn't agree more, Supriya. I think Anthony really hit the nail on the head, so to speak, and the connection to mental well-being and the effects that alopecia areata has on someone's mental and emotional well-being. It's something that I think has come up a lot already in this episode, and it just speaks to the inherent connection of someone living with the condition and also their mental and emotional health. And it's something that we also dive into in detail in a future episode, actually, with a clinical psychologist, Dr. Lori Ferguson and other patient guests. So we're really excited about that. But I think to build on what Anthony was saying, and I think it's really, really important in regards to how a provider may approach this situation as well, because it's such a sensitive topic. And I was wondering if you, Dr. Sibbald, a question for you would be, how do you ensure patients, psychologic safety and kind of mental and emotional well-being, kind of curate a safe environment for them to speak about what's going on and be willing to hear about options maybe for treatment or to help them just confidently make a decision so they feel comfortable in whatever decision they make, whether that's treatment or something else?
For sure. Thank you for that question. I am still working on this myself. And so I don't have the perfect answer. But one of the things I really like about having a specialty clinic is it allows me to see what I see in that clinic is just patients who are newly diagnosed to me. And it gives me a little bit more time. We have a dedicated social worker who's in that clinic. And so for every single patient, we discuss it as a group and we go in there. And I'm very cognizant of normalizing the anxiety that I think is present in every single patient that I see. And so I put that up front. And, the struggle with children as well is that it affects the whole family unit. And so there's parental anxiety and consequences as well. And so addressing both of those up front and then making it very clear that number one, I want to make sure that we address that mental health piece. And that's why the social worker is there. And then she stays back and speaks with them a little bit more about resources available to help with the mental health piece. And then also to make sure that they're aware that I'm there as their clinician to help, confirm the diagnosis, to make sure that they're healthy, that they don't need something reversed or prescribed. But in terms of the treatment, I want to work with them. If they are happy not trying creams or pills to get their hair back, that's fine with me. I don't have a strong motivation to put everyone on a medication. My goal is really to help them through this journey in whatever way I can. And I hope that resonates. We also, if they want to think about things, we'll give patients resources and written materials to think about decisions before they make them. But as I said, it's an ever learning journey for me as well to improve the care that I provide.
Dr. Sibbald, I know you said you're still working on it, but I feel like you're doing an amazing job because I think you're the first dermatologist I've ever heard of who's including a social worker from the jump. And that is such a huge step to take to prioritize the mental aspect of things. And then also the fact that you're considering treatment an option, not a must. That's both of those things make you an incredible doctor. So thank you for what you're doing to prioritize this community.
Dr. Sibbald, as a follow-up to that with what you mentioned, what kind of factors should come into play when deciding whether or not to treat alopecia and go on a treatment? What do you consider in that?
So it's always a very careful discussion about the side effects and the benefit. So, there are side effects from any treatment that you take, whether that's something that you're putting on the scalp that could cause irritation. All of these Janus kinase inhibitors do have some side effects, and many of them are rare, but that's a discussion that we definitely need to consider when we're thinking about right now a medication that you probably need to take long term. And because of that fact that we're seeing when you stop medications, the hair falls out. So I think there's many different factors, which is why I think it must be like a joint decision between the patient and the clinician prescribing to understand that whole puzzle of side effects, benefits, what to expect.
Thanks for that.
Anthony, with all that we've discussed in mind, what do you think has been the biggest impact alopecia areata has had on you? And how have you overcome any hurdles that you've experienced throughout your hair loss journey?
So I think for me, growing up, I was always a little bit shy, but once I developed alopecia areata, it really hindered my ability to present myself in public. I was very nervous about how people would perceive me and, what they would say about me. And I think that was the biggest impact, was just my ability to kind of socialize with others and to live my life essentially. And while mental health care certainly was pivotal in me rising above that, I think The other thing that it was a little bit of a revelation that I had. I just realized that, as difficult as this is, life is going to continue whether I want it to or not. And so I can choose to be a victim and kind of wallow in my sadness, or I can do something about it. So getting that mental health care was the first step, but I think a lot of introspection and figuring out who I was as a person and realizing that alopecia doesn't have to stop me from being the human being that I want to be and doing what I want to do. And so that realization allowed me to slowly but surely get back into living my life. Although I finished my high school diploma from home, I did finish, and I went to university, which when I was first diagnosed, I didn't think I'd be able to do, but I did it, and I graduated, and now I'm doing my master's and one day medical school. So I think just realizing that you can be whoever you want to be, irrespective of alopecia areata. It doesn't have to be the thing that stops you. And in my case, it's the thing that actually motivates me to keep going.
Such an incredible response. I think it perfectly encapsulates everything that we've discussed today, actually, is about not letting the condition stop you from doing and being who you are and pursuing that to the fullest. And I think, in that regard, as we come to a close with our two wonderful guests here, I'd just ask Dr. Sibbald a last question is, what is one word or phrase of advice you would want our listeners and fellow alopecia areata patients in Canada and around the world to remember?
That is such a hard question to answer. I'll definitely go with a phrase. And I would say that, unfortunately, it's never a good thing to be diagnosed with a condition. But if you're going to be diagnosed with alopecia areata, now is a good time. It is exciting in terms of treatment options, but also that concept of if you don't want your hair to regrow, it's also an exciting time because we're recognizing more and more how we can live with the disease and not just have it affect us, as Anthony so beautifully said.
Such a great response. Thanks for that.
Anthony, same question for you. What would be your one word or phrase of advice our listeners and alopecia areata patients should keep in mind?
Yeah, I know you said one word, but it's kind of a two-parter. So the first, I would just reiterate what I said about alopecia areata doesn't have to be the thing that stops your life. You can be whoever you want to be. You can do whatever you want to do with or without hair. And then the second piece would be that you're not alone. I think alopecia areata, when you're first diagnosed, you feel incredibly alone because it's not something that we see too often in public. But do know that you're not alone. There are resources out there for you. And even though you may not see that many people with alopecia areata, there are plenty of us. And so you don't have to be alone in this journey.
Thank you. As I hear your story throughout this entire podcast, I think about when people say life can either happen to you or for you. And it seems to me for you said, okay, alopecia areata happened to me, but now I'm going to make it happen for me. And you've really taken the control back. You've become a force in this space and you're on the forefront of changing the landscape for the options available to the community. And that's truly incredible. I'm really proud of you and proud to know you and honored to have been able to connect with you on this podcast.
Thank you so much.
Thank you so much, Dr. Sibbald and Anthony, for joining us today. It was truly an incredible episode and so much valuable information to share with the community. We really appreciate your time and just can't wait to share this with the world.
Thank you so much for having us and for all your work in this area as well. I think the podcast is a great option to reach out to patients.
Yes, thank you. It's really been an honor and a pleasure to be here today with all of you.
And I can only second what Supriya said. Thank you both so very much for joining us. And I'd actually like to ask Supriya as a very last question of the episode, which would be your takeaway. What is your takeaway from today?
Yes, I've been taking notes this entire episode as well, and so many things. I think my biggest takeaway is one, how exciting it is to see the landscape of alopecia areata change. I know when I was diagnosed in 2015, everything just felt so hopeless. Nothing had been approved yet. Everything was up in the air. And so I felt like there were no options available to me. And hearing Dr. Sibbald talk, it's so exciting to know that when somebody gets their diagnosis now, that their options are viable and exciting and there's a lot more choice involved in what the future of alopecia areata looks like. So it warms my heart. It makes me pumped to see what's going to happen in the next 5, 10, 15 years. I can't even imagine, but I love it. And just to reiterate what I said about Anthony, I just felt very inspired by everything he said. And I love that he took this condition that happened to him and has made a career out of it and is now the voice of our community and helping change what happens for us in the future. And that to me is just so amazing.
And that brings us to the end of this episode of From Hair to There, a podcast about alopecia. This podcast was made possible with support from Pfizer Canada. We hope the stories, insights, and voices we've shared have touched you, educated you, and made your journey a little brighter.
Living with alopecia areata is more than just hair. It's about resilience, identity, and community. And together, we're building that community one story at a time. If our words resonated with you, please take a moment to rate us, leave us a glowing review, and share this podcast with your friends, family, and networks. Every share amplifies our voice and helps someone out there feel understood. And if you have any questions, comments, or episode topic ideas, you can email us at podcast@ghlf.org.
And remember, whether you're on the path of acceptance, seeking treatments, or anywhere in between, we're with you, from hair to there.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.